The Senior Protection Act just became law. Here's what it actually means for you. Stop what you're doing right now because something was just passed in the United States Senate that could directly impact your retirement, your health care, and your financial security starting this year. Millions of American retirees have absolutely no idea what's actually inside this legislation. We're talking about stronger protections against abuse in care facilities, new limits on what seniors pay for prescription drugs, and updated rules that could put real additional money into your monthly Social Security check. But here's what major media outlets aren't telling you. Not every change happens automatically. Some benefits only activate if you know how to claim them, and there are critical deadlines you could miss if you wait too long. We're breaking down every major change in plain, simple English. No legal jargon, no political spin, so you and your family know exactly what you're now entitled to and what steps to take right now to protect your future. Let's get into it. Where this law came from. For decades, seniors in this country have been navigating a system that simply wasn't designed with them in mind. Prescription drug prices that made absolutely no sense. Nursing homes operating with almost zero real accountability. Social security adjustments that barely kept pace with actual living costs. Financial fraud that robbed hardworking retirees of their life savings. These weren't minor inconveniences. These were genuine crises unfolding quietly inside millions of households across America. And most of it was happening without nearly enough attention from the people making decisions in Washington. This new law is one of the most comprehensive pieces of legislation targeting seniors in an entire generation. It touches nearly every area of life that matters most to people over 60: healthcare, housing, finances, and personal safety. The reason we need to discuss it in such detail is simple. The news cycle moves fast, and what gets reported are the headlines. But the details, the actual practical real life details, that's where the real value lives for you personally. Prescription drug pricing reform. One of the first and most discussed elements of this bill involves prescription drug pricing. If you're on Medicare, this is something you've been waiting a long time to hear. For years, Medicare was legally prohibited from negotiating drug prices directly with pharmaceutical companies. Think about that for a moment. The largest purchaser of prescription drugs in the entire country was not permitted to use that size and purchasing power to negotiate lower prices. Private insurance companies could negotiate. The Department of Veterans Affairs could negotiate. But Medicare, which covers over 65 million Americans, simply could not. The result was that seniors were paying some of the highest drug prices in the entire world for the exact same medications that people in Canada, Germany, and Japan were purchasing for a fraction of the cost. This law expands and accelerates the drug pricing negotiation process significantly. Under the new provisions, Medicare can now negotiate prices on a much broader list of medications, and those negotiated prices take effect faster than any previous timeline allowed. In practical terms, if you're currently spending $200, $300, or even $500 monthly on medications for diabetes, heart disease, or arthritis, there is a real possibility those costs come down on a rolling schedule that begins now. The bill also caps annual out-of-pocket drug expenses for Medicare beneficiaries, meaning there's a firm ceiling on what you'll ever pay in a given year, regardless of how many medications you take. For millions of seniors who have been forced to choose between medication and groceries, this is genuinely life-changing. Social Security changes. Now let's talk about Social Security because this is the section that gets people fired up, and rightfully so. Social Security has been the financial backbone of American retirement since 1935. It was built as a promise. You work, you contribute, and when your working years are finished, the system supports you. But over time, that promise began feeling uncertain. Cost of living adjustments, known as COLA, are supposed to protect your benefits from inflation. Every year, the Social Security Administration reviews inflation data and adjusts your monthly payment accordingly. But here's the core problem, and seniors have been raising this concern for years. The inflation formula used to calculate those adjustments doesn't reflect how seniors actually spend their money. The standard formula tracks spending habits of urban workers and office employees, factoring in things like gasoline, electronics, and job-related expenses. But seniors spend money very differently. They spend significantly more on healthcare, prescription medications, and in-home assistance. Those specific categories rise in price faster than almost anything else in the economy. This legislation directly addresses that problem. It advances the adoption of an inflation index specifically designed to track senior spending patterns. What this means is that your annual Social Security adjustment would actually reflect what your life genuinely costs, not what a younger working professional's life costs. Over time, that difference can mean hundreds of additional dollars annually in your pocket. When you're living on a fixed income, a more accurate inflation adjustment, compounding every single year, adds up to something very real and very significant. There's also language in the bill addressing Social Security's long term funding stability. Without going too deep into technical details, the longstanding concern has been that the Social Security Trust Fund would face depletion around the mid 2030s, triggering automatic benefit reductions. Nobody wanted that outcome. The legislation strengthens the funding structure primarily by adjusting the payroll tax cap, meaning higher income earners contribute more into the system, stabilizing it for everyone. This protects your benefits not just today, but for decades ahead. And if you have children or grandchildren who will eventually rely on Social Security themselves, this matters directly for their future too. Nursing home reform. Let's move to nursing home reform because this section doesn't get discussed nearly enough despite being absolutely critical. If you or someone you love currently lives in a care facility, or if you're thinking ahead about potentially needing that level of care someday, what happens inside those facilities matters enormously. The unfortunate reality is that nursing home abuse and neglect has been a persistent and devastating problem across America. Reports from federal health agencies have consistently shown that a significant percentage of nursing homes have been cited for serious violations, including inadequate staffing, poor sanitation, medication errors, and in the worst cases, direct physical and emotional abuse of residents. Under this legislation, nursing homes receiving Medicare and Medicaid funding, which is the vast majority of facilities, are now subject to significantly stricter staffing requirements. New rules mandate minimum staffing ratios, meaning a required number of trained caregivers must be present for every resident. This may sound like a bureaucratic detail, but what it practically guarantees is that your mother or father will have an attentive person available when they need help, rather than a single exhausted aide managing an entire hallway of residents alone. Understaffing has been the root cause of countless tragedies inside nursing homes, and this bill takes direct aim at that problem. The legislation also dramatically increases financial penalties for facilities found violating resident safety standards. Previously, fines were modest enough that many operators simply absorbed them as a routine cost of doing business. That changes now. Penalties increase substantially, and repeat offenders risk losing their Medicare and Medicaid funding entirely, which for most facilities is effectively the end of operations. That consequence creates powerful motivation to genuinely follow the rules and treat every resident with dignity. Additionally, new transparency requirements mean nursing homes must make inspection reports, staffing data, and violation histories easily accessible to the public. When you're researching a facility for yourself or a loved one, you'll now have access to honest, real information rather than just the polished brochure from the front desk. Elder financial fraud protection. Now let's spend time on something that still doesn't receive the serious attention it deserves, and that's financial fraud targeting older Americans. This is a silent epidemic. Every year, seniors across this country lose tens of billions of dollars to scammers, con artists, and financial predators. The schemes take countless forms: fake government agents calling by telephone, Medicare billing fraud, bogus investment opportunities, romance scams targeting widowed individuals, contractors who collect deposits and disappear, and in some of the most painful cases, family members or caregivers exploiting their access to an elderly person's finances. Federal investigators have consistently ranked elder financial exploitation among the fastest growing crimes in the nation, and victims are often too ashamed or confused to report what happened. This legislation establishes dedicated funding specifically for elder fraud prevention and prosecution. That means more trained federal investigators pursuing these cases, greater resources supporting victim recovery, and stronger coordination between federal agencies, state law enforcement, and financial institutions. Banks and credit unions are now encouraged and, in certain situations, required to flag suspicious transactions in accounts held by seniors and maintain protocols for reporting suspected exploitation. This matters enormously because in many real cases, the bank sees the warning signs first. A sudden, large, unexplained withdrawal, multiple wire transfers to unfamiliar accounts, a new name suddenly appearing on an elderly customer's account. These are recognizable red flags. Under this new framework, financial institutions have both the tools and the clear responsibility to act on them. The bill also funds public education campaigns targeting seniors directly because the most reliable defense against these schemes is genuine awareness. When you know the warning signs and understand the tactics fraudsters use, you're far less likely to become their next victim. Housing and aging in place. Let's talk about housing now. For many seniors, their home is simultaneously their largest financial asset and the emotional center of their entire life. The desire to age in place, to grow older, surrounded by familiar surroundings in your community, is something most older Americans want deeply. But the reality is that homes are often not built for the physical demands of later life. Staircases become dangerous. Bathrooms without proper supports become accident sites. Standard doorways become barriers for someone using a wheelchair. Making necessary modifications to safely remain at home can cost thousands of dollars, and for seniors on fixed incomes, that money is frequently simply unavailable. This legislation significantly expands funding for home modification assistance programs. Through grants and low-interest loan programs administered locally, eligible seniors can now access real financial help to make critical safety improvements. Installing ramps, widening doorways, adding walk-in showers, improving lighting, and making kitchens more accessible. These are not luxury renovations. These are the essential changes that allow a person to remain safe and independent at home rather than being moved into institutional care before they're truly ready. The bill also addresses affordable senior housing more broadly, investing in expanding housing options specifically designed for older Americans with built-in accessibility features, proximity to healthcare services, and genuine opportunities for social connection. Isolation is one of the most serious and underappreciated health risks facing seniors today. Research has shown that chronic loneliness among older adults is as physically damaging as smoking 15 cigarettes daily. That's not exaggeration. That's documented research. By investing in housing designed to keep seniors genuinely connected to their communities, this bill addresses not only physical health but mental and emotional well-being as well. Mental health access. On mental health, which people still don't discuss openly enough, this legislation includes provisions specifically expanding access to mental health services for seniors through Medicare. Currently, accessing mental health care through Medicare can be complicated, expensive, and limited. Many therapists simply don't accept Medicare patients because reimbursement rates are too low for providers to participate financially. And the deeply rooted stigma around mental health, especially strong among generations who grew up never discussing emotional struggles openly, keeps many seniors from seeking help even when they desperately need it. This bill removes barriers by improving reimbursement rates for mental health providers serving Medicare patients and expanding telehealth options so seniors in rural areas or with mobility challenges can access counseling from home. Grief, loss, chronic pain, and fear of dependency are genuine emotional burdens millions of older Americans carry daily. The belief that seeking professional help for those burdens is somehow unnecessary or reflects weakness is simply wrong. And this legislation actively works to challenge that harmful idea. Caregiver support. Let's address caregiver support because this falls through the cracks in nearly every policy discussion, yet affects tens of millions of families nationwide. Currently, there are an estimated 53 million unpaid family caregivers in the United States. These are sons and daughters, spouses, siblings, and close friends who have taken on the enormous responsibility of caring for an aging loved one, often while working full-time, raising children, and managing their own health challenges. The physical and emotional toll of caregiving is staggering. Burnout is real. Depression among caregivers is extraordinarily common. Yet historically, these individuals have received virtually no financial assistance, no formal training, and almost no recognition from government programs for the work they perform. This legislation changes that meaningfully. New tax credits are available for qualifying family caregivers, allowing people spending personal funds on a loved one's care to recover some of those costs through the tax system. Funding for caregiver training programs ensures that family members managing complex medical conditions at home have access to proper education and support. And expanded respite care options allow caregivers to take temporary breaks without feeling they're abandoning their responsibilities. A rested, supported, and well trained caregiver is simply a better caregiver. And a better caregiver means a better quality of life for the senior depending on them. Medicare expansion. Let's address the broader conversation about Medicare expansion. There has been significant debate about whether to extend Medicare coverage to include dental, vision, and hearing services. Currently, standard Medicare doesn't cover routine dental care, routine vision exams, or hearing aids. This is a serious gap because dental health directly connects to overall health. Untreated gum disease is linked to heart disease, diabetes complications, and cognitive decline. Vision problems increase fall risk and social isolation. Untreated hearing loss is one of the strongest controllable risk factors for dementia. These are not optional services. These are fundamental healthcare needs. This legislation makes meaningful progress here. While a complete Medicare expansion covering all dental, vision, and hearing needs remains politically unfinished, this bill takes real steps in that direction. New subsidies help Medicare beneficiaries afford hearing aids, which can cost thousands of dollars and are rarely covered by insurance. Pilot programs expand dental care access through community health centers for Medicare patients. And increased funding supports vision services through community health programs. It's not everything advocates have pushed for, but it's a genuine step forward heading in exactly the right direction. What you need to do right now. Now let's talk about something directly connected to everything we've covered, and that's staying informed and taking action. One of the most important things you can do following this legislation is understand your own specific situation, what you currently receive, what you may now be eligible for, and what steps you must take to access new benefits. Because as we mentioned at the start, not everything in this bill is automatic. Some benefits require an application, some require updating your information with Medicare or Social Security. Some have enrollment windows you don't want to miss. Start with your local Social Security office or the official Social Security Administration website. If your state's health insurance assistance program has a Medicare counselor available, which every state does at no cost, schedule an appointment now. These counselors are specifically trained to help you understand your Medicare benefits and navigate changes exactly like those this legislation introduces. They're free, unbiased, and exist specifically for people in your situation. And please be cautious about anyone contacting you claiming to help you access new benefits while asking for money or personal information up front. Scammers act fast. Within days of major legislation passing, criminals craft pitches around it to trick seniors into surrendering Medicare numbers, Social Security numbers, or banking details. Legitimate government services are always free. The Social Security Administration will never call demanding immediate action. Medicare will never request your credit card number over the phone. If something feels wrong, hang up immediately and call the official number directly. Final thoughts. Think about your own life. Think about the specific moments when you felt the system simply wasn't built for you. Maybe it was standing at the pharmacy counter forced to decide which prescription you could afford this month. Maybe it was watching a parent suffer in a facility too understaffed to provide proper care. Maybe it was discovering someone had been stealing from you financially. Maybe it was sitting alone on an ordinary afternoon, wondering if anyone truly understood how difficult this stage of life can be. This bill is not a perfect solution. No single piece of legislation fixes everything, but it is a genuine, substantial effort to improve the daily lives of older Americans in tangible and meaningful ways. And perhaps more than anything, it sends a clear message. The United States Senate looked directly at the challenges facing seniors and said, "We see you, we hear you, and we're going to act." After years of feeling invisible in policy conversations, that matters deeply. There are still battles ahead. Implementation requires time. Budget fights happen every year. The powerful interests that profit from keeping things unchanged, pharmaceutical corporations, understaffed nursing home chains, financial predators, will not step aside quietly. They will lobby. They will litigate. They will chip away at every gain made. which is exactly why staying informed, staying engaged, and remaining part of this conversation matters so much. Because the strongest protection any law has is a knowledgeable public that understands what's at stake and refuses to allow it to be taken away. Knowledge is power. Subscribe to this channel for more valuable content, and please turn on the notification bell.